clinical stages of HIV in children and infants. In part 2, we are going to look at the third stage. In third stage, looking at the general, it can include the unexplained modern malnutrition. Malnutrition can be seen, and it is not being cured with the adequate standard therapy. It is not getting cured. There can be the unexplained. Everything is unexplained here. So unexplained diarrhea, persistent diarrhea, it can be for 14 days or more. There can be unexplained fever, persistent fever, and this is done above 37.6 degree Celsius, and it can be intermittent as well as constant, and it is given for more than 1 month. Next, we are looking at the unexplained anemia. So unexplained anemia basically means less than 6 gram per dl, and there can be neutropenia. Neutropenia is nothing but less than 0.5 into 10 to the power 9 per liter, as well as there is chronic thrombocytopenia, and this is nothing but less than 50 into 10 to the power 9 L. Now looking at oral. In oral, there can be persistent oral candidiasis, and this is basically after the first 6 to 8 weeks of life. Then there can also be presence of the oral hairy leukoplakia, and there can also be presence of acute necrotizing ulcerative gingivitis, as well as the peritonitis. Now looking at the respiratory. In terms of respiratory, there can be the pulmonary TB as well as the lymph node TB. There can be presence of the severe recurrent bacterial pneumonia, and there can be presence of the symptomatic lymphoid interstitial pneumonitis, and there can be a chronic HIV. This associated lung disease. This includes the bronchiectasis.